Hi everyone, after a few weeks of break, so we are back to our educational video. As you might remember, in the previous video I talked about lung cancer, the prevalence and risk factor. So today I want to talk about different types of lung cancer. How is the staging, how is the grading, and what's exactly the conventional medicine for lung cancer. So lung cancer divided to bronchogenic carcinoma and non-bronchogenic carcinoma. Among bronchogenic carcinoma, we have two major categories, small cell carcinoma and non-small cell lung cancer. So small cell lung cancer consists of 15% of cases of lung cancer, is mostly seen in women and is strongly associated with smoking. It spread very fast, so that's why that we see a rapid decline in patients' well-being and lung performance. Small cell lung cancer is very sensitive to chemotherapy and radiation, but unfortunately after completion of treatment, the recurrence rate is very high. Then non-small cell lung cancer consists of 85 to 90% of lung cancer cases. They are divided to three different groups: adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. So adenocarcinoma, mostly seen in women, and it's the type of lung cancer which is seen also a lot in non-smokers. It fasts also very rapidly, and the survival rate, the 5-year survival rate with adenocarcinoma is just 5%. A squamous cell carcinoma is mostly seen in men and is associated strongly with smoking. Because it's located mostly in the center of the lung, one of the highlighted symptoms of the patient is hemoptysis. And in these patients, 5-year survival rate is around 20%. Then large cell carcinoma can be seen in both men and women. It's strongly associated with smoking. It grows very fast. That's why the 5-year survival rate for large cell carcinoma is around 6%. Another category of lung cancer is bronchogenic, non-bronchogenic carcinoma. The most important one is mesothelioma, which is mostly related to long-term exposure to asbestos and is mostly occupational related. In terms of the staging of lung cancer, we have a system of the 4-stage groups based on the tumor size, lymph node involvement, and spread to the other organs. So stage 1 is when the tumor size is less than 5 centimeters, as only located in lung. And then we go to the stage 4, which is a spread of the cancer outside the lung. So in terms of treatment approaches, usually in a stage 1 or sometimes in a stage 2, which cancer is still very localized, the first treatment option is surgery, and sometimes patient might need extra radiation or chemotherapy, but after surgery. Neoadjuvant chemotherapy, which is the chemotherapy before, is not usually recommended in lung cancer. But in a stage advanced stage 2, in stage 3 and 4, usually chemotherapy and radiation are a better option for the patient, and sometimes oncologists, they don't recommend surgery and right away do chemotherapy for the patient. We also have targeted therapy for lung cancer, which usually specified based on some genetic testing and any gene mutation that is recognized. So that treatment is specifically focused on gene mutations. Also, immune therapy is a new era in lung cancer treatment. In next video, I will talk about naturopathic approach besides conventional medicine for lung cancer.